Everyone, welcome back to the second episode of Girls Let's Talk. In today's discussion, we're going to meet with Dr. Rachel Thwaites-Williams to discuss SRHR and to debunk some myths and misconceptions on sexuality education and menstrual health. So SRHR, sexual and reproductive health and rights, are fundamental human rights that are currently being denied or restricted in several parts of the world. SRHR includes so many issues such as abortion, HIV and other STIs, menstrual health, contraceptive access, gender-based violence, discrimination, stigma, and much more. I know many of you are thinking, I'm just 16, I just live in St. Lucia, a tiny little island in the Caribbean, no one's ever heard of me, no one's ever heard of my island, this has nothing to do with me. I'm telling you that is not true. We do not live in a bubble. Everything that goes on around us, everything that's happening in our world affects us indirectly. So please pay attention. See, the perceived need to control female sexuality and other inequalities make accessing information and services very challenging to girls across the globe. So like we did in the last episode, now we're going to call our trained professional in this field. We're going to be calling Dr. Rachel Thwaites-Williams to walk us through a trial consultation.
For the past 2 months, my stomach cramps during my cycle have intensified significantly. I now feel them both on and off my period. I have also started experiencing radiated pain in my legs. Through my Google searches, the combination has led me to believe that maybe I have a pelvic infection because my pelvic area has also started to feel sore and painful when touched. People think that this is normal because as a woman gets older, her period changes. But do you think this is normal? What would you recommend my next step to be?
After discussing everything and trying to narrow it down to maybe 1 or 2 differentials, encourage the patient to get a physical examination. That's very important for this patient. So they may have a gynecologist already, they may have a GP already that they are comfortable with, then by all means go to them, or we would refer otherwise. And just give them a heads up that it's quite possible they would need to have, abdominal and pelvic examination, and ultrasound would be needed in this case, and it's possible that blood work would be needed depending again on what we found in taking the history and doing the examination. So for the most part, that's pretty much what we would do in this particular case, and just hold the patient's hand.
Neither my friend nor I are sexually active. However, she recently got her mother to agree to put her on the pill. Her mother thinks that she's having sex, but in reality, she is just using it to reduce acne, and it has been working for her. She secretly began sharing her supply with me, but my acne has just gotten worse. Since then, I have also had these excruciating stomach pains. I don't want to tell my mother for fear of punishment. Google says that birth control is different for everyone, that it could be good or bad. So what is your opinion on it as a medication for acne?
Obviously, to alleviate this situation at hand with the worsening acne and abdominal pains, we'd go through the rest of the history, examination, and encourage the patient to stop taking the pills that she got from the friend. We'd have to definitely do history examination, and there's a checklist that we always go through before we start patients on the oral contraceptive pill, and definitely focus on sexual health education, and so on. So
my boyfriend and I have been together for 4 years now, and now that I'm old, I feel like I am ready to take the next step in our relationship. This will be the first time for me, but not my partner. We've spoken about being safe, but he doesn't want to use protection. I am full-blown panicking. I have a ton of uncertainty, fear, and a lot of questions. Do I need to see a gynecologist before? Will I get an STI? Should I ask him to get tested? How will I know what to do? What contraceptive should we use? Will it hurt? What can I do to prepare? Can you help me?
the best thing that you can do is to empower yourself with knowledge and empower yourself in terms of protection. And there's so many options for protection out there that vary in terms of what's best for different patients, depending on their age, their situation, etc., that we could discuss. So this is an excellent opportunity to build a rapport and to impart some sexual health education.
Thank you, Dr. Thwaites Williams, for walking us through that consultation. Now we're going to look at some common myths and misconceptions related to sexuality, menstrual health, etc. So underneath the first heading, contraception and safe sex, number 1, the pill is effective immediately after you begin taking it. True or false? Number 2, I won't get pregnant if I shower or take a bath right after sex, or if I urinate right after sex. True or false? The next heading is STDs and STIs. Number 1, you cannot get STDs from oral sex. True or false? Number 2, only people with multiple sexual partners get STDs. True or false? Number 3, STIs or STDs go away without seeing a doctor or without medication. True or false? The last heading, sexuality and gender identity. Number 1, it's just a phase. True or false? Number 2, all gay people were abused as kids. True or false? And lastly, number 3, sexuality education encourages young people to have sex. True or false? Thank you so much for joining us for this second episode of Girls Let's Talk. I'm excited to see you guys next time on the third and final episode. Again, if you haven't booked your appointment, don't forget to log into girlsofafeather.org/telehealth to book an appointment. If you booked an appointment already, book your next appointment. Bye. I hope you have a great day. Ash spoke.